The MRCT Center presents Time to Listen, hearing from young people in clinical research. We asked some children about their experience in clinical research. Their answers will help strengthen your partnership with pediatric participants.
I'm Jan, and I'm 16 years old, almost 17. I'm from Barcelona in Spain.
Ma'am, my name is Sandhya, and I am 18 years old, and I am from India.
My name is Megan. I'm 11 years old, and I'm from the United States of America. And I think that adults can learn a thing or two from kids.
What is it like when a doctor or researcher talks to you?
I really don't like it when they talk to the adult, but they don't talk to me, because it's as if they think that my opinion doesn't matter.
मैम ऐसा लगता है कि मैम जब बीमारी मेरी है तो मैम डॉक्टर डायरेक्टली मुझसे क्यों नहीं बात कर रहे हैं और मेरे पेरेंट्स से क्यों बोल रहे हैं मैम ऐसी फीलिंग्स आती है और फिर लगता है कि मतलब कुछ तो है और डॉक्टर मुझे नहीं बता रहे हैं.
If I was younger, maybe I should not listen to all of it. My parents, I would say, would have to choose which thing I would have to hear and which thing not.
What is the best way to give you information?
I like it when they use visual information and schemes or videos, which help me understand the medical procedure itself. I don't like when they just use their voice, because sometimes it's hard when they say a lot of things to remember and understand them correctly. In an ideal world, a 3D model of the, in this case, imagine a tumor. You could see from all the angles and you could really understand the situation. So you were less scared when you went into the procedure. So maybe that's the best way you could be handed information, but maybe it's not that realistic nowadays.
When I understand the most is when I'm actually talking to someone and know that I can say something back and that they can fill me in on more if they need to.
मैम उनको फ्रेंडली होना चाहिए क्योंकि अगर मैं एज ए लड़की हूँ या फिर गर्ल हूँ तो मैम उनको ना फ्रेंडली होना चाहिए. जिस एज के अकॉर्डिंग उनके पास पेशेंट्स जा रहे हैं उस एज के अकॉर्डिंग उनको फ्रेंडली होना चाहिए. उनका जो बॉडी लैंग्वेज और बात करने का तरीका, वे ऑफ टॉकिंग, ताकि जो सामने वाला पर्सन है वो कंफर्टेबली उनसे शेयर कर सके जो भी उसकी प्रॉब्लम है.
What is it like to ask questions?
Sometimes I hold it in because I'm scared that maybe I'll appear stupid.
The doctors know a lot more about this procedure you're going into, or the clinical study you're going to enroll in. But with the parents, they know your personality and your feelings better. So there's two kinds of questions, and you ask the doctor more about the medical stuff and the parent more about the personal stuff.
मैम थोड़ी हेजिटेशन होती है क्योंकि सामने जो इससे हम क्वेश्चन पूछ रहे हैं वो उनके पास ज्यादा इंफॉर्मेशन है. और सर मैम थोड़ा ये भी लगता है कि जब उनके पास इंफॉर्मेशन है तो मेरे पास भी थोड़ा बहुत तो होना चाहिए.
Do you think that adults really listen to kids?
Sometimes they say that they're listening, but they're actually doing something else and looking away and they don't understand. We kids need to recognize the difference between people who say that they're listening but actually aren't, and people who say they're listening and actually are.
जब वो प्रोजेक्ट हमारे लिए काम कर रहा है तो उसमें हमारी भागीदारी होती है. उसमें हमारे ओपिनियंस पूछे जाते हैं. हम जो फील करते हैं, हम जिस चीज से सफर करते हैं, वो सारी इंफॉर्मेशन प्रोग्राम जो भी है उनके हेड वो सब लेते हैं और मैम उसमें हमारी पूरी भागीदारी होती है.
I'm in Kids Barcelona, so in my point of view, I am really being heard because I am in an advisory group. Doctors and specialists come to us even when they have questions they want us to answer. But I can understand and I can relate to other patients that are not involved in this kind of groups, that they really can feel powerless.
What is one important thing that you want adults to know?
I think it's essential for the parents to understand the information as well as the children, because the parents are the ones that know their son or daughter best, so they can afterwards explain it to the patient, I mean to their son or daughter. And also it's necessary and really important to ask the patient how they want the information to be delivered, because I would say they are the ones that know better themselves how they will understand the information better.
We all know that adults were kids once. They were just like us. They felt the need to be loved and to be listened to. So I don't think that it's so necessary for them to learn to listen to kids, but to relearn what it's like to need to be listened to.
ऐसा एटमॉस्फेयर होना चाहिए जो बच्चे उसमें कंफर्टेबल हो, जो कोऑर्डिनेटर्स हो उनका बिहेवियर फ्रेंडली होना चाहिए बच्चों से, ताकि बच्चे उनके साथ अच्छे से कोऑर्डिनेट कर सके, वर्क कर सके और जो भी प्रोग्राम है उसमें अच्छे से पार्टिसिपेट कर सके। बिकॉज अगर एटमॉस्फेयर और जो भी प्रोग्राम का कोऑर्डिनेटर है उसका और फ्रेंडली बिहेवियर होगा तो बच्चे उसमें, हमारे जैसे बच्चे उसमें अच्छे से पार्टिसिपेट कर पाएंगे।
If you could interview a researcher or a doctor, what would you ask?
तो मतलब वो जो भी है जो भी पेशेंट है उसको कैसे फेथ दिलाएंगे कि हाँ वो जल्दी ठीक हो जाएगा या फिर उसका डर दूर हो जाए बस।
If I had a researcher in front of me, 3 specific questions that I would probably ask them. 1, do you even remember what it's like to be a kid? That would be a preface to dig a little deeper. 2, I would ask them, why am I important to your career? And once I understand and make sure that they understand how I'm important to their career, I would ask them, how can I help you do a good job helping me?
Key points. Talk directly to the child. Use visual forms of information. Create a comfortable environment. Remember what it was like to be a kid. Children are nervous about asking questions. Youth advisory groups can access the child voice. Parents are part of the information delivery process. Help children help you to do a better job.
And now we need to think of one more question that's maybe not so scary.
I don't do things that aren't scary. I don't do it. I want to look threatening.
Okay.